I'm Dr. Christina Blacher, and I'm a general dentist in Dallas, Texas. I really chose dentistry to help make a difference in people's lives. I have a smaller practice. It's 4 operatories. I have 1 full-time hygienist, 1 part-time hygienist, 2 assistants, and 2 front desk. And just because we're a small practice does not mean we can't do big things. I do pretty much everything under the sun in dentistry, ranging from crowns, veneers, bridges, implants, extractions, and Invisalign. We pretty much do it all. I've used a lot of competitive scanners in the dental industry, and what drew me to iTero was honestly I was embarrassed that I claimed to be up to date on all the latest technology advances, but I was still taking PVS impressions for Invisalign. That was the main driver towards the iTero, but it also seamlessly integrated into my practice. I use the iTero for all my restorative. All my lab work is flawless. It really integrates well with my practice and with the labs that I use. I have 2 iTeros in the practice. Both of them are iTero Element 2s, and I absolutely love them. I use them in all elements of my practice. I actually implemented what's called a smile assessment in all of my hygiene exams. And we introduce our iTero in our office not as an Invisalign tool, but as a diagnosing tool. We take scans on every single hygiene patient every single time, and we use that to look at their bite, how their teeth come together, and it helps open the conversations about Invisalign and about possible treatment that may still be pending. The patients love being able to see their 3D models, they can play around with it, and it's so easy to look at and user-friendly that it really has helped transform the practice. Every aspect of the iTero is valuable, including myitero.com. I utilize it in hygiene when a hygienist has to pass off the scanner before they're ready to have the discussion, and I always have it pulled up in my office so I can look at scans before I come in to see the patient. My favorite features of the iTero platform starts with the occlusogram in the viewer tab. This is my go-to. Every single time we take a scan of somebody, this is the first thing I pull up. It lets us look at their occlusion, their bite, how their teeth come together, and really opens the conversations for talking about Invisalign. Once we talk about Invisalign, the outcome simulator speaks for itself. This is how I get so many patients to close on Invisalign cases on the first day. So many doctors think that they need to market to new patients in order to increase their Invisalign treatment, but to be honest, the answer was already in the practice. Since implementing my smile assessment tool in my hygiene exams, I have seen almost all of my Invisalign treatment cases come from the patients that were already existing patients in the practice. Our treatment count has grown exponentially, and to be honest, I'm just trying to hold on for the ride. It is going so fast. The iTero scanner has truly transformed my entire practice. It has energized my staff, it has excited my patients, and it has truly made a huge difference in our practice. I'm all about creating a positive environment that patients love coming to, and the iTero does just that. It truly makes a top-of-the-line dental practice in both atmosphere and quality.